I have a big notification, by the way, sitting up here, and I just looked right over the top of it. So I'm glad I have you. Okay, we are now recording. Okay, so again, operational planning is developing and entering the operational plans into the system, understanding what all the different levels look like, and then we're actually going to go in at the end and enter the operational plan, the tobacco cessation plan, into your account. We're going to use a template that was actually created by one of our health departments in Wisconsin as the source. And a lot of people like to use this template. So the template was actually attached to the meeting invitation you've got. So if you want to start out that way and develop it offline and then kind of copy and paste it into the system, that works out as well. So let's go ahead now. The nomenclature that you see here is very, very common, but it's not cast in concrete. A lot of people want to kind of have their own nomenclature in these plans, and a lot of times it's the same verbiage, but it's in different places on the plan. And I've never really understood that, but a lot of times people will send me a plan and say, "Here's our new chip. Can you help us get it in the system?" And you look at it, and these names are kind of different in different places here. So what I'm going to do is go through some examples that we've seen of different plans. And the idea here is if somebody gives you a plan and it's an operational plan, it has kind of the same pyramid model, but the naming is different, you'll be able to kind of look at that and say, oh, I see this as a service or this is a goal or whatever. So let's look at some of those examples here. Okay, here's the first one. Strategic priorities, what we call services or initiatives, goals, strategies, and objectives. So strategic priorities is really a good nomenclature for services initiatives in a strategic plan. And this is probably the most common place you'll see that is in a strategic plan. Then goals is goals. Strategies, I'm not real sold at strategies being the objectives because strategies to me are a way to get to the objective here. So I think they got those two kind of flipped around here. The objective is the target. Strategy is kind of how I'm going to get to the objective. So just, I guess, my 2 cents worth in here. Strategic areas is another real good definition of the services or initiatives. Then goals. The term outcome objectives, I like that. What is the outcome we're trying to accomplish? What's the objective? And then again, maybe strategies is pretty good down here. Strategies to get to the objective. Priorities at the top, goals, objectives, and action steps. That's a real good nomenclature. Priorities is another good term for the services or initiatives. Action steps is the most common term we see for activities other than activities themselves. Priority areas is another kind of a good definition up there. Goals, again, strategies, I think is in the wrong place, and then action steps. Priorities, goals, objectives, and strategies, a good one. Then this one, they put strategies at the top. I don't know. Strategic objectives, I like that term because it's kind of a level higher than an objective. So, yeah, pretty good. And then get down to the action steps. So again, somebody's going to hand you a plan at some point in time. It's going to have some mixture of the nomenclature. You can look at it and say, yeah, this really looks like a goal or this looks like a SMART objective. Now let's go look at some of the real life examples here of each level. So groups, again, is the structure of your organization plus the primary plans. So first thing, let's go look at your group screen here. So here it is. The group level indicates the hierarchy. Levels go from 1 to 10. You can get there. Nobody's ever gotten past 5 or 6 to the best of my knowledge in here. But your department is typically the top level group. Then you'll see what FAB calls their 6-pack of plans down in here are reporting up to the department level. You have a group called accreditation, which is a level 2 group reporting to the department. Under accreditation, you have the FAB accreditation plan as a level 3 group reporting to accreditation. So the bottom line is that a level 2 group always reports to a level 1 group, 3 to 2, etc. And then also the parent group is also established. And if you see down here at the bottom, we have the group level and the parent group. So in this case, we're saying the parent group is the accreditation group and the group level is 3 because the accreditation level's 2. And the system will work with you to, if you're trying to establish, levels that are outside the norm, it'll kind of give you the idea that, hey, you need to move this up a level or whatever. So this is your groups. Now you get down past here and you get down to your administrative support group. You got communicable disease, community health, education, environmental health, et cetera. So you can see all those different groups. Over time, you may be adding subgroups, you may be moving these around. The reporting may change, that kind of happens as reorganizations happen. So it's real simple to move these things around. And the only person who can really do that is the org admin. So you can go into the group here and say, I want to move admin down a level or up a level. And basically it's just making these settings down here at the bottom. So just kind of like we talked about here, the department is typically your highest level group, level 1 group. Underneath that, let's say we have a group called community health. Community health being a level 2 group reporting to the department at level 1. Maybe under community health, we would have WIC. WIC reporting to community health, which reports to the department. And again, like I said, if WIC were elevated to move right to the department, you can change it to a level 2 group, change the parent group to department, and poof, presto, change-o, it's there. Now, those primary plans we talked about, what FAB calls their 6-pack of plans, or any high-level plan, can be an independent group within itself. Sometimes plans start at this level, like your strategic plan typically is a group. Some plans are kind of a lower level, so they might start at the service initiative level. Same thing with your community health improvement plan, typically a level 2 group reporting at the department. And then again, for today, we're going to use the group Tobacco 2024, which we're saying is a level 2 group as well. So the groups, again, are the structure of your health department plus the highest level plans. Now, underneath the groups, then, we're going to have services or initiatives. Services being ongoing things that you're doing. And again, I use the example of WIC as being a service that public health provides. It's been around forever, will continue to be there. Initiatives are programs that we're trying to roll out in the future here. Not a lot of difference in the structure of the plans other than when you get to reporting, it says initiatives for the service. And when you get down into the activities, the dates are typically future dates versus current dates for services here. So let's look at some real live examples here. Healthy moms and babies. Now, I kind of think of these as the buckets. These are buckets containing plans. So healthy moms and babies. Readiness for emerging health threats. Effective agency processes. Access to care. Behavioral health and substance abuse. Population health. Organizational excellence. Chronic disease prevention and control. Health disparities. And again, for today, we're going to use the example of tobacco cessation. So again, these are priority areas or buckets. They're not actions at this point in time, but they're containing a set of plans that will get you to healthy moms and babies, or to behavioral health, or to population health, or whatever. Now, underneath the services initiatives, where we start getting down to the real actions in here, and we're starting out with what we call the high-level goals. So high-level goals are typically an action verb followed by a few words. It gives you a big picture definition of what we're trying to accomplish. So again, here's some live examples. Reduce the risk of infectious disease. Promote safe and sanitary food establishments. Support communities in building resiliency. Enhance healthcare through technology. Drive health in all policy agendas. Reduce the risk of vaccine preventable diseases. Promote public health readiness and response. Promote succession planning and career growth. Integrate a data-driven best practices approach. And then again, we're going to use the example of reduce smoking in high schools. Now, if I tell you reduce smoking in high schools, everybody knows what that means. It's pretty simple. But what it doesn't get to is the detail, like which high schools, like when are we planning on doing this, like how much do we plan on reducing smoking. So that's where we're going to take it down to the next level, what we call the SMART objectives in here. So here's some examples of SMART objectives. Again, specific, measurable, attainable, realistic or relevant, depending on what you like in there, and time-based. Typically focusing on a specific, measurable, and time-based here. So here's some examples. By December 2024, identify 2 or more strategies to collaboratively reduce risky alcohol-related behaviors. So in this case, the specific is the strategies. The measurement is 2 or more, and our time base is by December 2024. So it meets the criteria pretty well there. By December 2024, 80% of educators and school staff have been exposed to ACE awareness education. By June 2024, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, all programs will have established goals, objectives, and activities to be reported on within the VMSG dashboard. And then for today, we're going to use the example again of reduce smoking at Wayne High School by 25% by the end of the school year. I think you can look at each of these and determine, what is specific, what is measurable, and what is the time base. So kind of think about that as you're developing objectives. It kind of has to contain all 3 of those. Now, when I say has to, it doesn't have to. Typically it does. There's some things as you're moving from one plan to another that, is not that specific. So there are some anomalies in there. Now, underneath the objectives, we're going to have a set of activities, the action steps, the steps we're going to go through that we believe will get us to our objective. In the dashboard, as we talked about, there's 3 distinct types of activities. I'm going to go into a little bit of detail here, but then when we go and enter it in the system, I'm going to go into great detail and show you all the different options in there. So our first activity we call a project-based activity, the first type of activity. Now, this was the original and only type of activity when we first developed the system in here. Think of it as anything that's a project. So in this case, create training content materials for students and faculty on the dangers of smoking. So we're going to make PowerPoints, we're going to make some videos, make some user guides, that sort of thing. So, it's a project. The performance measure for every activity basically defines how do I know when I've successfully completed the activity. Now, the project-based activity is the only one where you manually create the performance measure. The other 2 types kind of automatically do it for you in here. So in this case, what we're saying is once the training content materials have been created, we're done with the activity here. We have a date range in here, beginning and ending date. We're going to do team assignments. So we're going to have team members and team leads. Potentially, we're going to have external partner assignments. So if you've got external folks you're working with, you can attach those to the activities. Then we're going to have a measurement in here. How do we know when we're complete? In this case, the default is % complete. And again, there's a couple other options I'll show you in there. But, if we're building training content, once we're halfway through, we're 50% complete. We're 3/4 of the way through, we're 75% complete. So that's kind of how that is set up. Project-based activity is by far the most common and the simplest type of activity. Our next type of activity we call a quality assurance activity. A couple of unique things. Number one, as we talked about, it's repetitive. And the cycle time, or what we call the frequency, can be anywhere between weekly and every 5 years. So it's repeating, and you're always measuring within that time frame. So in this case, we're providing 9 training sessions each month on the dangers of smoking to students and faculty. And the fact that we have a lot of additional information in this type of activity, we can actually set the traffic lights automatically. Now, for the most part, traffic lights are manually set. A couple options, that I'll be showing you here in a few minutes that automatically set it, and this is one of them. So in this case, we're going to say, if we provide those 9 training sessions, the light's going to be green. And then we're going to say, 6 is not good enough. So, and it's just a number we picked. So if we say, we only do 6, the light's going to be red. And then you can imagine 7 or 8 is going to end up being yellow in there. So automatically set the traffic light and repetitive on a cyclical basis here. In this case, instead of a beginning date and ending date, we have a cycle start date and a frequency. So as you can imagine, if it's May 1, you can calculate the ending date to be the end of May in here. Once we move to June 1, then the ending date becomes the end of June. So the ending date, there's still an ending date, but it's calculated instead of entered in here. Our performance measure in this case is going to be created for us. It's going to say training sessions provided, measured monthly, and then our green, yellow, and red. And then team and partner assignments. And as you can imagine, our metric in this place is pretty simple. How many sessions did we provide? So we're going to go in there on a monthly basis or whatever we're doing and say, hey, I did my 9 training sessions. The light's going to turn to green, and away we go. So this is, by the way, the least used type of activity, only because it's very specific to having something that's repetitive and automatically sets the traffic light. The third type of activity and the second most used type of activity we call a quantitative measurement activity. And really the only difference between it and a project-based activity is that we have a target quantity in here. So in this case, we're going to contact all 20 tobacco vendors within a mile of Wayne High School, sure they're not selling to minors. So in this case, you can see our target quantity is 20. So when we have that, it makes it easy to do calculations, right? I'm counting up and say, okay, we did 20 this month. That calculates to be 100%. We did 15 this month, we're 75%. So it's pretty simple to do that. And there's a lot of things that you'll count, believe it or not. Dollars is one thing. You can use this to manage grant funding. You can manage budgets. You can manage all kinds of stuff by using dollars in there. Just lots of different things. Some things you just want to count. How many vaccinations did we do this month? So it's easy to manage that way. In this case, we have a beginning and ending date, just like we did in a project-based activity. Our performance metric will be created for you. And so it's going to say 20 tobacco vendors contacted between May 1 and June 30th. So that's how we know we've completed the activity. And then again, team and partner assignments. And as you can imagine, our measurement is real simple. How many vendors did we contact? So those are the three types of activities. Now, what I'm going to do is take all the blue that you saw at the bottom of each of those screens and build them together into a plan just on a screen here. So number one, the group was tobacco programs for 2024. The service or initiative, in this case we're calling it an initiative, was tobacco cessation. Our goal here is to reduce smoking in high schools. Our SMART objective is to reduce smoking at Wayne High School by 25% by the end of the school year. Our first activity is to create the training content. Our second activity then is to take that training content and go to the schools and provide the training. And in parallel, we're going to go out and contact those tobacco vendors. So that's kind of one part of the plan. Now, we might back up here to another goal of reduce smoking in colleges. And now underneath that, we're going to have another SMART objective, in this case, reduce smoking at Wright State University by 25% by the end of the school year. And then we'd have a set of activities under that. So this can repeat at any level. You can have multiple services and initiatives. You got tobacco cessation. You could have as many of those different types of initiatives. You can have as many different goals: reduce smoking in high schools, reduce smoking in colleges, reduce smoking in public places, whatever you want to be able to do in there. So that's kind of what the plan looks like in a format like this. Now, I mentioned we have this template, and again, I attached the blank copy of this template. It's a Word document. And the reason it was created is because some people weren't comfortable yet going into the system and entering plans, and they didn't want to, mess up and do something wrong in there. So they created this Word document. And basically, it's kind of cool because it goes down the hierarchy here. So first thing is the service or initiative, and they put a definition in it. So what bucket of work or priority does this relate to? That's a pretty good description of the service or initiative. In this case, it's tobacco cessation. Our first goal: what is your pie in the sky or high level goal to reduce smoking in high schools? Then we get down to our objectives. Specifically, what and when do you hope to accomplish? And then our first objective here: who's going to lead the charge? So who's the objective lead? Our activities: what are the steps you will do to accomplish the objective? You see the activities down here. Our performance metric is: how will I know when I've successfully completed the activity? Our activity leads is who's primarily responsible to do and update this activity, and then when are we going to accomplish it? So what we're going to do now is we're going to take what you see here, and I'm going to go to the live Word document here so I can copy and paste out of it. One of the reasons I copy and paste is so you don't have to sit here and watch me type. It's kind of easier to do it this way. So I'm going to go ahead up here. First thing, I'm going to grab this first initiative, tobacco cessation. I can right click and copy. I like use keyboard shortcuts, so Control C is copy. So I'm going to grab that. I'm going to go back over to our your account here. I'm going to go down to the bottom. We have a training group down here at the bottom, which is just a sandbox. Basically, you can do anything, and this is where I'm going to ask you to enter operational plans when we get done here. I'm going to go down to my group called Tobacco 2024 under the training group. Then I'm going to go down to the Services Initiatives tab. Now, it's closed off right now, and you can see I can roll over. I can't do anything here until I either click this plus button or this plus button. So I'll click down here, opens up the field for me, Control V. So I put tobacco cessation. Again, we said it's going to be a future program or an initiative, so I'll check there. I'll go ahead and save that. Now, what's happening here, just kind of from a technical point of view, is everything down here in the blue is happening in locally on your computer here as you're doing it. It's in a buffer, basically. Once I hit this save button, it shoves it up in a fraction of a millisecond up to the server. And that's what makes the system able to handle literally thousands of users at the same time, because there's just very little interaction going with the server. Most of it's happening on your local machine. Let's say for a second that tobacco cessation is a completed program. We did it last year and we're done with the program. We want to keep it, but we want to kind of take it out of the mainstream here. That's what this hide service down here is for. If I check that, save it again, you'll notice it grays out up here. What this means now is that a normal user won't even see this. A manager level or org admin level user can see it, report on it, take information out of it, do whatever they want to do with it. But a normal user just doesn't even see it. So it kind of basically hides the service up there. I'm going to go ahead and uncheck that and unhide it. So now we have our tobacco cessation initiative up there. Now let's go back to our plan here. We're going to grab reduce smoking in high schools. Again, Control C, go back over to here. I'm going to go down to my goals here and again, I'll click the plus button this time over here. Does this exactly the same thing. Control V to paste it in there, reduce smoking in high schools. I'm going to go ahead and save that. Now, this is where the traffic light comes in. If we're entering an initiative, it's a new program, which means it really hadn't had time to get behind schedule. So it's probably going to be green. Now, a couple of ways you can change the light. I can just cycle through it with my mouse here. Gold, yeah, red, yellow, green. Usually it's going to be green. It's going to stay that way in here. And by the way, anytime you change anything on the bottom, you got to save it so it goes up there. If you try to leave it, it'll give you a notification, say, hey, you sure you don't want to save this in here? So this is my goal. Now, I believe we had some other goals in here. So let's scroll on down. There we go. Reduce smoking in colleges. So I'll grab that. Control C, go back over here, hit the plus button, opens it up. Control V, save it. And I think we had another one down here. Reduce smoking in public areas. I'll grab that. Control C, go back over here, hit the plus button, Control V, save that. So now I have my 3 goals in there, and I'm going to have plans underneath all of those. For today, we're just going to build out reduce smoking in high schools. Now, to get to the objectives for reduce smoking in high schools, I have 2 options. Either I can click on reduce smoking in high schools and then hit the objectives tab, or this is what we call a drill down over here, the little right arrow here. If I click on the right arrow next to reduce smoking in high schools, it does 2 things. It selects reduce smoking in high schools, takes you to the objectives tab for that. Basically, all it does is save you a mouse click. But if you got a whole bunch of goals in there, you can easily, click to go to the objectives tab for the specific goal. Again, I'm going to open up the objective down here at the bottom. Go back over to here, scroll back up to the top. Our first objective, reduce smoking at Wayne High School. Okay, I grab that, Control C, go back over here, paste it in there, Control V, go ahead and save that for now. Now, again, I've got the traffic light I can set. It's an initiative, so it's probably something new. Now, down here at the bottom, what are we going to measure? Right now, the default is objective percent done, which would be 0 to 100% done. In this case, we're measuring percent reduction. So what I'm going to do is click on the title here, objective percent done. It's going to open this little window here. I'm going to say percent reduction. My measurement units are percent. And I have the option down here. I can say decimal, which means instead of counting percent, I'm going to count widgets or vaccinations or whatever, something tangible. But in this case, I'm going to go ahead and leave it as percent. So I'm still measuring in percent. So I'm going to click on that. You see now it says percent reduction, and currently we're at 0%. I'm going to say we're at 20% reduction right now. I'm going to go ahead and save that. Now, this is something that was added at the request of a couple of our health departments. Because most of the traffic lights are manually set, if you make a change to the target value down here, does it affect the traffic light? So just kind of giving you a reminder here says, hey, if you're only 20%, should this traffic light be set to yellow? Who knows? Let's go ahead and do that for now. Let's go ahead and set it to yellow and save that again. So the only time you get that notification is if you're actually changing this down here and it says, oh yeah, I should have changed that to yellow because we're only at 20%. The next thing we're going to want to do is add an objective lead. So by clicking on the drop down here, the reason nobody shows up in here is because we're looking within the group Tobacco 2024, which is a training group, and nobody's assigned to the group. So show me all users here. So I'll click on that. I'm just going to go up here and pick Dawn, the first one on the list up here, and save that. So now Dawn has 2 jobs. Number one is she's going to be the project manager for this particular project to get us down to the 25% reduction. And number 2 she's going to be updating the current status wherever she gets that information from. And we'll talk a little bit more about that here in a minute. And the way that that's going to happen is, again, through that real-time planning we talked about. Dawn will be getting an automated email from the system, typically monthly. In that email is a link that will take her right back into this particular objective. She can go down and do the update, typically through the quick update system we talked about. She's going to update that. She's going to save it. It's going to ask her if she needs to change the traffic light, and she can go ahead and do that. So we'll go ahead and save that. Okay. Now, the other thing we might want to do is put notes in here. Now, I've got a couple of options here. I can say, this is a test note. Save that. The other option I have is adding a date, time, and person stamp to the note. So if I click on this guy, you notice it puts the date, the time, and system admin is just my username in this particular case here. And this is why you don't want to watch me type. And we'll save that. So anytime I add a new date and timestamp note, it's going to be at the top of the list here. So I can continue to add that. The nice thing about it is who did what when is what you're actually putting in there. Now, down here at the bottom, we have data source. Data source is where am I going to go to get the information to update the status here. In this particular case, it's probably a little nebulous, but you might say maybe Wayne High School tracks that on their webpage, or maybe CDC tracks that. So to add that data, the data source is basically a link to the place that we're going to go to get the information. That link, by the way, can be on your intranet, it can be in your file servers, and it can be on the internet. So to do that, I just click here. It opens up this little window, and I'm going to say we're going to go to the CDC smoking cessation fast facts webpage. Now, when I put in a data source link, again, it can be your intranet, it could be HTTP, FTP, whatever you want it to be in here. If you're doing something on your intranet, you may have to get hold of your IT folks to allow that link through the firewall, because this is actually coming from our servers out in LA, coming back down into here. Every data source link has got to start with something like HTTP : could be HTTPS, could be FTP, lots of different things you can put in there. But typically, if it's an internet link, it'll be HTTP or HTTPS. And we're just going to say www.cdc.gov, and there's a whole link after that. If you have the link to that particular web page, which you can find, it does exist, you can grab that link and paste it right into there as well. For now, I'm just going to say the CDC webpage because that's all I know right offhand. So now you'll see that it put the description down in here and added this little link button. That's a chain link if you can't see it. I'm going to go ahead and save that again. Now the chain link button here, when I open that, pops open a new browser tab and takes me right to the CDC webpage. In the case that we were talking about, it would take me right to the CDC smoking cessation fast facts webpage, but I didn't have the full link in there. So I'm going to go ahead and say that's where we're going to go to get the information to update the objective in here. So that is the objective. Again, the objective is the target. The target is we need to get to 25%. Currently, we're at 20%. Now, to get there, we're going to add those activities. And the activities, there's lots of different options, so we'll be going through those. Again, I can either drill down over here, or I can just go to the activities tab since I just have the one objective. I'm going to go to my activities tab. I'm going to go ahead and open it up here at the bottom again. Go back over here, and so let's grab our first activity, which is create the training content. You notice I marked it as a project-based activity, so we'll enter it as that. Control C, go back over here, paste it into here, Control V. Now, in this case, we're going to create the performance metric. Again, how do I know when I've successfully completed the activity? So we're creating training content. Once we've created the training content, we're there. So we'll just grab this, Control C, paste it into here. We're going to do this in a specific date period. So I'm going to go ahead and say from May 1 through May 31st in here, we're doing that. Go ahead and click on that to save the activity. The first time you save an activity, it takes a few extra seconds because it's doing a lot of work in the background in here, linking it to everything else. Okay, so now this is our activity, create the training content materials for students and faculty. My performance metric, that's how I know when we're done. This is when we're planning on doing it. These can be varied over time as necessary. So now let me go down here and add a note that says chapter 1 of 4. And I'll go ahead and save that. And probably because I've created chapter 1 of 4, that indicates to me it's about 25% done. So this is our measurement over here. So I'll go ahead and save that. Did it update the traffic light? No, we're okay because we're still moving through the period of doing it here. So you'll see up here in the top, it's 25% done. This is our measurement down here. The next time I might go in here and add another note that says chapter 2. And in this case, I'm going to probably make it 50% and save it. And we'll say okay. Okay, now this is the activity itself. Now, who is going to do this activity? Go over here to this pencil icon next to activity leader and team members. Click on that. Again, we're in the tobacco group, so nobody shows up. I can select people from another group with this drop down, or if I just hit the little black X, it says show me everybody in the department. So let's go down here and pick Miranda as the lead. And you notice the 3 columns, team members, so you can have as many team members as you want. You can have a team lead, and you can have actually as many people on the email notification, but typically it's the team lead. So by hitting the lead, you automatically set team member and email notification. And then we'll just go ahead and pick a couple other folks to be team members on here. So these are the folks who are actually going to be building the training content here. Go ahead and save that. So they show up down in here. You can have as many of them attached as you want, by the way. So the L indicates lead. Excuse me, the blue around the L indicates the email notification, and the T obviously is team members down here. So these are the folks who are actually going to be doing the activity. Miranda is going to be the person who's going to get the email to go back in and update the status of this. Typically, she might go in and put in a note that says completed chapter 3 and change that to 75%, something along that line. The other thing you see down here are the activity partners. I don't believe you guys have any partners in here yet. So the left side of the screen would be partner organizations. You might remember from our previous training, we had VMSG dashboard as the partner organization. And under VMSG dashboard, one of the contacts was Fred Erickson. So you can select as many partners as you want, and you can select as many contacts from each partner as you want. So you can have a whole bunch of partners attached to an activity. In this case, since we don't have anybody, we won't attach them at this point. So that is our first activity, kind of with all the different features here. Now, there's a couple of different options I wanted to show you here. If I'm doing this over the course of, let's say, a month, I'm creating this training content, and I want to keep a measure, how far along we are, I'm going to use the 0 to 100%. This little wizard button here opens up the wizard for each type of activity. Each one's a little bit different here. So I've got the beginning and ending date, which is exactly the same. I can enter either place. But data entry type. Let's say I'm going to create all this training content in 1 week, and on Friday I'm going to go in and say I'm done. So I can just use this option, the complete option. Now you notice instead of a 0 to 100% over here, it gives me a little checkbox. Go ahead and save that. So now, my checkbox, when it's unchecked, is 0%. When it's checked, is 100%. So you just got the 2 options. And again, that makes sense if you're just going to complete it and say I'm done with it and not have to worry about going 25, 50, 75%. So when I check that, boom, one thing you may notice is the traffic light over here turned to gold. Gold indicates successful completion of that portion of the plan. Because I'm 100% complete, it automatically set to gold. Now, that's one of the few automations of the traffic lights. Because this particular type of activity may never really be done, in this case it would be, but there's some of them that may really never be done. You can override that. You can go back in here and change it back to a green or whatever if it's ongoing. But by default, if you're 100%, it's going to turn it to gold up here. So that is activity 1. Let's go back and grab activity 2, which is that QA activity. So I'm going to provide 9 training sessions each month. Control C. Go back over here. This time we're going to hit the plus button to add a new activity. Control V, provide the 9 training sessions. And again, I'm going to call this a quality assurance activity. So I'm just going to select that. Opens the wizard for me here. So I'm going to set a few things. So we know we're doing the training sessions monthly. So I'm going to select the frequency. If you look at these, you go anywhere between weekly and every 5 years. So you got a lot of options here. We're going to pick monthly. The start date, I'll go ahead and leave it at 5/3. Now, this is where we decide to set the value. So we know that if we get to 9, that's our target. So we're going to call that green at 9. And we're going to pick a number like we choose before. We're going to pick 6 as we're not happy with 6. And you'll notice it calculates the yellow for you automatically here. My metric type is training sessions provided. And when I save that, it builds out the performance metric for me. So training sessions provided, measured monthly, and our green, yellow, and red. Now, again, you notice down here, it just has a cycle start date and no end date. And again, if it's 5/3 and we're doing a monthly cycle, 6/3 or 6/2 would probably be the end of that particular cycle start date in here. I'll go ahead and save this one. Okay, now the light turned red automatically. Again, remember this one sets the light automatically because we basically have 0 in our actual number in here. If I went in here and put in, let's say 7, we know that's between 6 and the 9, so that should be yellow, and it turns yellow. I go ahead and save that. Now, after the first time you enter a QA activity, every time you go to save it, it's going to give you this option. Do you want to update the cycle start date? Here's how that kind of works. If I'm doing it, let's say I'm doing it, I'm doing my training sessions on a monthly basis, but let's say every week I'm going to go in and do an update. Maybe I did 3 training sessions this week and 3 the next week. If I'm done for the month, I'm going to go ahead and update the cycle start date to the next month. My choices are no, it's just leave it as is. I can say select, which means pick a date for the future. It's going to automatically give you the beginning of the next month. Or I can say current, meaning it'll set it for today's date, which would be the same. So if I hit select here, you notice it puts in 6/1 of 24, so the beginning of the next month. I'll go ahead and say okay to that. The cycle start date now moves to 6. So what I was saying is I completed my 7 training sessions for last month. Now I'm going to go into the next month and be measuring in the June timeframe in here. So that is the QA activity. Now, there's some more options in the QA activity here. One of those, this timeline I'm going to go through at the end and build a totally unrelated activity, but just to show you the feature in here. But the plus or the greater than or equal to and the less than or equal to are buttons here. There are some things that less is better. So I use the example of a golf score. Lower is better, right? So if I'm going to change this to less than is green, then I got to clear these 2 fields out, change it to a less than. This one will change to a greater than, and maybe less than 3 is green and greater than 6 is red or something like that. So you can have it either way. It just kind of depends on what you're measuring in the activity in there. So that is the options for the QA activity. So that is activity number 2. And again, this is the least used type, just again, because it's very specific to something that's repetitive and automatically sets a traffic light. Let's go grab our third activity here of contact all 20 tobacco vendors. Control C. Go back over to here. Let's go ahead and add a new, we'll go ahead and save the changes here. We won't update the cycle start date. And I got a fly who's trying to attack me here. Control V, contact all 20 tobacco vendors. This one we know is a quantitative measurement activity. So again, we've got the wizard here. We've got our beginning date. So let's call it May 1 through May 31. We know our target number is 20, so we'll put that in there. This is where we can select decimal or dollar. Decimal is anything other than dollars. It's just, counting vaccinations, counting widgets, counting car seats, whatever it happens to be. Dollars is just that. It gives you $sign and 2 decimal places. The metric type in here is going to be tobacco vendors contacted. And then we have a couple options down here. I'll come back to those in a minute. The first one is enter a value to add to total. We'll save that. Our performance metric gets created. 20 tobacco vendors contacted between 5/1/24 and 5/31/24. Our beginning and ending date here is already there, so we'll go ahead and save this. Now, the option that I selected, add to the total, is right down here. So let's say the first week I go in and contact 5 tobacco vendors. it rolls it up to the running total of 5, and it calculates it to be 25%. So 5 divided by our target number of 20 is 25%, obviously. So I'll go ahead and save that. Check the traffic light. Now, the next option then here is next week, maybe I'm going to go in and add another 5 contacts that I made. It rolls up to 10, calculates to be 50%, and away we go in there. So that's pretty simple. So that is one of the options here. A couple other options we have is enter a new total value. So if I click on that, you notice our summary field goes away. Again, this is kind of the same thing we talked about when you're creating the training content or doing the training sessions. If I'm going to do all contacts in a week and I just want to go in and say, I'm done at the end of the week, I can just say 20 and it calculates to be 100% and we're all set to go here. So those are 2 of the options. Now there is a third option on here. You notice everything is calculating the percent complete because we have a target number. What if I just want to count something? So I want to count the number of vaccinations we did this past month. I can go into here and put in what we call a 0 target. So if I put in a 0 target, then it has no more target number in here. So it just says tobacco vendors contacted. So maybe we don't know how many vendors there are. We just want to go to, at the end of the month, know how many we did. So you notice the percent calculation goes away, and this is just a running total now. And I have the 2 options on that one as well. I can go down to here, and if I'm having a running total over the course of a month or a quarter, I can say, okay, contacted 2 more vendors. It calculates to be 22. So that's the different options that are available on the QM activity here. So those are the 3 activities and the 3 types of activities in here in the plan. Now, I'm going to go ahead and add a 4th activity, which has absolutely nothing to do with this plan, but I just want to show you what this is about. This is what we call the timeline activity. And this is one, remember, we talk a little bit about this. If you have policies or standard operating procedures or MOUs that all have to be updated within a specific time frame, that's what this timeline activity is about. So I'm going to go ahead and add a new activities, and we're going to say update SOPs annually. So that's my activity here. I'm going to call this a quality assurance activity. I'm going to say annually because we're doing this on an annual basis. I'm going to go ahead and say I'm going to call it a timeline activity. My percent to yellow says at some point in time during the year, the annual timeline, the light's going to turn to yellow. When that happens, the person we designated as the activity lead is going to get that email notification to go in and update this. So let's go ahead and set this for the beginning of the fiscal year. So I'll use July 1 as the beginning. As the beginning of the fiscal year here. I'm going to call my percent to yellow 80%, which is about 9.5 months through the year, I believe. And we're going to say SOP updated, and then we'll create this. So the performance metric is SOP updated, measured annually. The light's going to stay green until we get to 80%. At 80%, it goes to yellow. When we get to 100%, it turns to red. Now, I'm going to go ahead and save this activity here. The way you'd use this, again, is if you had a standard operating procedure that need to be updated, you're going to go ahead and assign a lead here. I'll just pick Dawn number 2 here and save that. So now Dawn at 80% of the way through the year, 9.5 months through the year, is going to get an email notification to go in and update this. And what's she going to update? Typically, it's going to be a document that we have attached. So that was document management. I'll click on that. I'm going to go ahead and choose a file. I'm just going to pick a random file out of my directory here. So I have a test directory here. I'm going to say health and wellness SOP, and I'm going to upload that. So we're going to say SOP 3, we're going to call it. And then we're going to say fiscal year 2023. The traffic light, you can do whatever you want. A lot of people use this, especially when you're doing accreditation documents. Yellow is a draft, green is a finalized document, gold has been submitted to wherever, in this case to maybe to the EFAB system or something along that line. And I'm going to go ahead and save this. So now I've got my SOP document attached. So now I've got the SOP attached here. Now, if you're going to use this way to have the people update it, in this case, to have Don go in and do the update, you might want to make that like a locked Word document. So it's a Word document with a password on it. So anybody can go look at it, but only Don would have the password to go in and actually update it. If people have read-write access, they would be able to actually go in and update that if it wasn't locked down. So just FYI. However, what you can do is, what people do typically is build this under a group called SOPs. And then the group, you can set access permissions by person so that everybody except Don has read-only access. So they can get down there, they can look at that document, they can do whatever they want to do with it, but they can't save the changes to the document. So it kind of locks everybody else out from doing that. So again, what's going to happen at this point in time is, it says right now, because we're ahead of the end of the fiscal year, we're minus 16% of the timeline here. But what's going to happen when we get to 9.5 months through the fiscal year, the light's going to turn yellow. Dawn is going to get an email notification that says, please go in and update SOP number 3 here. She's going to go into here. It's going to take her through the quick update probably. She's going to grab the document, download it, do the changes to the document, upload the new version. The version control is handled automatically for you. And then the light's going to turn back to green. The timeline's going to get set back to the next fiscal year, and you're all set to go again. If Dawn doesn't go in by the end of the year and update it, the light turns red and everybody sees the red light, meaning that the SOP has not been updated. So as you're going to look at it, you say, oops, this is an obsolete SOP, something like that. So this is kind of one of the latest features that was added. And I'll tell you what, it is gangbusters popular, because it seems like every health department we deal with has got policies and SOPs and MOUs and grant documents and FAB documents and everything else that have to be updated on a regular basis. This automates that entire process for you, puts all the documents in a place where everybody can get to them. Again, put it into an SOP group, and then manage permissions by person to the group, which we'll go into in the admin training here, how to do that. But then everybody can have read access, so they can go see the SOP, they can use it for what it's meant to be, but they can't make any changes unless their name is Don. So that was the plan. And the plan in the pyramid looks like this, with the exception of the one we just added here. The group was Tobacco 2024. Tobacco cessation was the initiative we selected. Remember, we had several goals. We picked reduce smoking in high schools, reduce smoking at Wayne High School, and then the steps we're going to go through to get there. So that is the operational planning process. Again, every plan fits into this model. What I'm going to ask you guys to do, this is the only homework we'll have in the whole training course, is to go in and create a simple operational plan. And if you got something that you're working on for the department, please go ahead and build a piece of that out in there. If not, have fun. We've had planning my kid's birthday, planning a Christmas vacation, planning my trip to Las Vegas. Just had one that was planning a trip to England and Scotland. Whatever you want to do. Typically, you're going to have you're going to put it under the training group here. So just go down and select the training group. You go to the service initiative and you'll add a service, put in, plan 1, 2, 3, whatever it happens to be in here. And if you don't mind, in the end of it, put in parentheses your initials. That way, when we go back to review, we'll kind of know who did what. So you're going to have one service or initiative, one goal underneath that, one SMART objective. And by the way, just FYI, the place that doesn't meet the criteria most of the time is the SMART objective. So always think about specific, measurable, and time-based. Those are the 3 things that you should have in your objective. So by the end of the month, we're going to do ABC, whatever it happens to be. And then when you put the activities in, try to think of a way to use the 3 different types of activities. So a project-based activity will be, some project you're doing to get there. The QM activity is some project you're measuring by quantity. I'm going to contact 20 people for my kid's birthday, whatever it happens to be. And then the QA activity is something you're going to be doing every month. So maybe I'm going to send out invitations, 10 a month for the next 3 months or whatever it happens to be, something along that line. So basically, you're going to build 6 planning elements. Literally, it takes you, once you get in there, it takes you 5 minutes to do that. So I'd ask everybody to go in and create a plan, put it in the system if you can. If not, use the template that's in there, put it in the template. And what's going to happen is in the next session, we're going to give you control and let you enter it in the system and walk you through the process so you're comfortable actually working in the system itself. And then the next session, we're going to go review those. We're just going to walk through each plan and just kind of, critique it a little bit, maybe make some suggestions as to what you might do. One other kind of a hidden thing is at the activity level, please put in beginning and ending dates. If an activity does not have an ending date, it will not show up in a report. So think about having beginning and ending dates with your activities. Now, once you complete the next section, Andrea is going to send you a beautiful printed certificate in a little binder that you're going to be able to have put up on your wall. It says, I'm an operational planning expert in there. So kind of a little plus to plan, if you will, here. So that was what I had to go over today. Are there any questions or anything else you'd like to see? I'll take that.
I don't know if you have a question in the chat, but for the activity you said to put in the training section, if it's something that we actually want to be able to use, can we just put it in its correct category?
You can do that, or if you build the plan in the training section, we can move it over there for you. It's real easy.
Okay, great.
Yeah, whatever you're comfortable doing. Yeah, if you want to put it in its normal group, please do. If you want to put it in training, I'll show you how to copy it over to the normal group when we're done.
Great, thank you.
Okay, everybody. Well, thank you so much for your time. I'm going to go ahead and stop the recording now.